Okay, so welcome back. I think this is week 11. I'm starting to lose track of the weeks. I'm sure, like many of you are, we're already into June, so halfway through the year. So the usual format, I shall give an update on various matters for the next up to 30 minutes. We've got a couple of questions that have been sent into the inbox just before the call. So I'll do my best to answer those, and please just use the chat whilst we're going through the presentation if there's anything that you want me to try and pick up now, or we can certainly pick up afterwards. So for those of you that haven't joined before, welcome, and for those of you that have joined in previous weeks, welcome back. It's Sarah here, the Chief Exec. So I thought, first of all, just as I always start, a huge thank you. And we had our gold meeting this morning. We always have it on a Wednesday morning, just to get an update really on all of the arrangements, how those continue to be implemented to keep our services safe for staff and for service users. A huge thank you. It feels as though internally we've got into a really good rhythm now of managing in terms of keeping services safe, making sure we've got the right staff in the right place. I know that's a challenge 7 days a week. I'll start to reflect on what I think some of the challenges are going forward that we need to make sure that we're able to respond to. But in the past week or two, we have seen some of the lockdown restrictions lifted. Of course, we must make sure that we maintain that social distancing, regardless of the complexity of the national arrangements. The fundamental principles are the only way to make sure you don't contract COVID is to keep that safe social distance from other people is the best guarantee, and to obviously maintain good hygiene, hand washing. We mustn't lose sight of those as the messages seem to get more and more difficult to navigate and understand, shall I say. So hopefully some of you have been able to see loved ones, and we certainly had a good run of weather, haven't we? Although it seems to have turned today, sadly, so we've got a bit of rain for the next few days. Last week was also the last Clap for Carers. The founder of that felt it was timely after 10 weeks. It was time to bring that to a close. So hopefully everyone did go out last week and bang their pans and pan lids and show our thanks to one another. And that's not just Clap for Carers, we know, and you'll certainly see that when we look at the data that's been published this week by Public Health England of where COVID is having the hardest impact is on some of those frontline workers such as taxi drivers, security guards, a whole host of frontline workers that have continued throughout the lockdown to go to work in service of others. So you'll have seen from the news, we've had the launch of the contact tracing, and in fact you can't turn on the telly without there being some coverage of the NHS Test and Trace. So this has been run as a national programme in which there is a national centre, I don't know where they're actually based, of people employed to make contact with somebody if they've tested positive for COVID, and then to enable the tracing of people they've been in contact with, to let them know they've been in contact with somebody that's got COVID and therefore to go into isolation. You'll have heard various references in the press in relation to an app being developed, and that's being piloted on the Isle of Wight. It's fair to say that's not been without its challenges, and so we're certainly not expecting that to be featuring anytime, certainly within the next couple of weeks. If it is to be launched, it'll be in a few weeks' time, and it will only be part of the offer. I think this expectation that once we've got an app, we'll all be interacting and managing the risk of COVID using mobile-enabled technology, that certainly won't be the case. It's very much going to be a human endeavour of people doing the legwork of contacting, following up and giving people advice and guidance. It's still in the early days, so I think we just need to manage expectations of what that's going to bring. And actually what's most important is that local response. So some of the conversations we've been having within the lead system with the Director of Public Health is they're going to have a key role to play in using that intelligence to support local communities of where we would see a cluster of cases rather than these isolated cases, in order to put the right guidance and support in place. We also know that it can be complicated in terms of staff and service users. So if you are in an environment, so for our staff, where you're looking after patients with coronavirus, if as long as you're using PPE and keep up social distancing, then you wouldn't go into that 14-day isolation category. What we're going to do is, between Kathy Woofenden's team, the infection prevention team, and Claire Holmes, the workforce team, are working together just to produce some more simple guidance that we're going to get out by the end of the week. And again, that will always be available on our website, so look out for that. We're trying our best to simplify what is quite tricky to navigate in the national guidance, so that you've got a one place to go for that information, and basically you can phone up and get advice, not just for you but for your family members as well, as to what that means to keep yourself safe. One of the other aspects of the testing programme, which was announced at the very back end of last week, was the rollout of antibody testing programmes. So there's now a test, a full blood test it is, that needs to be taken by somebody who's phlebotomy trained. That'll go off to the labs, and that will let you know whether you have got antibodies in your system. So if you've got the antibody, what it means is at some point you've had COVID. What it doesn't do is tell you then whether you are immune from catching COVID again. So it's really important that if you want the antibody test, we've got 500 people already that have registered to have it. It shouldn't change your behaviour in terms of social isolation, hand hygiene, protecting yourself from contracting COVID. What they need to do is further research to see how long the antibody lasts for and whether that does offer any immunity. And there is now a research study getting underway. So we're just, hopefully by the end of this week, we'll start to roll out the first set of blood tests. And the first wave will only be for staff, because of the lab that we're able to use means that we can't put the patient data through it, but hopefully by next week we'll be up and running for both patients and for staff, and we'll continue to offer that on a daily basis. So again, we'll share more information as we get it. And thank you for all of those that have come forward. I know there's a lot of curiosity out there. A lot of people, myself included, have speculated, when you look back over the last few months when you've had various symptoms, was that COVID, was it not? So if you do want that test, please just, if you go on the website, you'll see the email to follow and get yourself registered. So I've just talked quite a bit then about the antibody testing, and there's the email address. So for those of you that can see that, if you do want that test, please use that email address, and we'll be back in contact with you to offer you an appointment slot. Symptomatic testing continues, and also asymptomatic testing. So if you need to, if you're based in Leeds, there's a Temple Green testing site. If you're not sure, if you live in further afield and some of our satellite sites, our staff over in York, please just contact the HR team using the usual routes, and they'll be able to tell you the nearest place. And there's also then the option for testing kits to be posted to people remains if you can't get to any of the drive-through sites. So I alluded to the Public Health England report just a few minutes ago. So this was released only yesterday. And what Public Health England have done is they have taken what data they've got on all of the people so far that have contracted COVID since the outbreak in England, and looked at various different characteristics to see if there is any correlation between the people who are contracting COVID and other key indicators, and what the outcomes are for people. So, and essentially who are most likely to die from COVID. So you'll see there's some of the data shared there, and it is available. For those of you on social media, you'll have seen it's been doing the rounds on Twitter. It's on the government website. It's open for people to read. And I suppose the first thing to say is, by and large, what's come out in this report is what people expected to come out of it. So the issues that have been raised, what we know from the media coverage and earlier reports, that there's that disproportionate impact on age, there's the disproportionate impact on gender, there's a disproportionate impact on the nature of the jobs that people do, and also where people live in terms of areas of deprivation. And there's, what I'm going to talk a bit more about is the disproportionate impact on colleagues and citizens, friends and family from Black, Asian and minority ethnic communities. What the report doesn't go on to do, and I think this is what we really wanted from it, if I'm honest, is to understand more detail why. These are shocking findings. They're difficult in terms of digesting what this means. We all get that sense of, once you know something, you want to do something about it, but you need to understand in more detail what's causing the difference in order to do the right things about it. And unfortunately, This report hasn't produced any of that analysis, and there's lots of speculation as to what causes that difference. And we'll see whether any further recommendations are released by the government. So whilst the report in itself doesn't answer the question why, nor make any recommendations, we don't have to wait for the government to make recommendations on what we should be doing to support our staff, in particular our BAME staff. You'll know we've been updating for the past few weeks on the experiences of colleagues in our own organisation. And some of you, again, will know, seen it through the media, seen it through social media, the devastating impact of what happened to George Floyd in America. I think there's not even, sometimes when really shocking things happen, you want to understand why. There will never be a rationale that would give any sort of logic to what happened to George Floyd and what went from him being approached by the police and then ultimately murdered by those police officers. Very clear that race played a significant part of that, and you'll have all seen, like I have, the knock-on consequences. That hits our BAME colleagues hard because this is, for many, part of their lived experience day to day in terms of fear of discrimination, direct discrimination, fear of violence, experiencing harassment, experiencing abuse. It's difficult, it really is difficult. And I know it certainly was discussed yesterday at our Equality and Inclusion Task Force group, and you'll see the messages we put out as a trust. We don't condone any of that, and we've got a moral and a personal obligation to stand by one another in terms of all our lives matter, and we need to go over and above to support our BAME colleagues because of the discrimination and the disadvantage and the abuse that they face. So that's part of our ongoing dialogue, regardless of what recommendations come out of the government. And as you know, our Race Equality Network meets on a weekly basis. This is about giving a forum to give people in our own organisation a voice, and where we have recommendations to take action from our colleagues, and that's our commitment to do that. As I've mentioned already, the REN is meeting again on Thursday. And I know certainly from Claire and Wendy have been having conversations about other ways in which we can create forums for people to come together, share experiences, share those experiences with the board to make sure we're taking every opportunity we can to deliver and drive the culture that we want in our organisation for all of our colleagues and really hold ourselves to account for how we continue to do that. One of the other pieces of work that we've been looking at is coming back to work safely. So at the moment, our advice and our position remains the same in that people should continue to work at home where they're able to until we can guarantee that we've took all the steps possible to make sure working environments are safe for staff and for service users for the clinical work that people need to undertake. This goes hand in hand with some of the work that we've took through the Equality and Inclusion group. So it's not just about getting it right in terms of working environments and the nature of the services we provide, but those individual assessments and where people are at in their personal circumstances and individual risk factors. So this isn't going to be a blanket approach, a blanket policy. We need to get it right, and it's going to be difficult to get it right for all of our services, for our service users and for our staff. So we're not going to rush, but we recognise that for some people it is stressful and it's hard working from home in terms of your own health and well-being. So please be assured we've heard that. I know staff that have the difficulty of doing telephone therapy or remote therapy in your own home, and especially how you can do that in a way which is balanced with other family members and the other commitments that you've got in your home environment. So work is underway. We got an update this morning. And we'll continue to get weekly updates, and we're doing it site by site, and each of those sites, what services operate out of there, and how do we get the balance right of who should come back into work from those premises. And again, thank you. I know it's difficult in terms of getting that balance. It has been a long period of time, but the more we get it right, the more sustainable it is going to be for the coming months. One of the areas I should have just explicitly mentioned on the previous slide is in relation to shielding. So there's been a bit of confusion over the weekend off everybody really, including the health and care sector, of the announcements that were made about changes to the shielding category. So for those who are in high risk groups that are at home. So just to be really clear, the only change that was announced by the government, despite the way it might have come across in some of the media coverage, is to be able to go outside once a day, but absolutely you've got to maintain that 2 metre social distance. And I have to reiterate, that's because if you're in that high risk category, if you contract COVID, the chances are it'll have a very, very serious impact on you. So this is absolutely a reminder of the importance of the steps you need to take to keep yourself at a minimum risk from contracting COVID. And certainly for our staff that are shielding, please don't be worrying about the implications for work. What we need to do is get it right for you, and I don't want staff to feel as though they're under pressure and juggling many things. What continues to matter for all of our staff and our service users is their safety at the heart of everything that we do. So I also then wanted, like I usually do, is to share some of our reasons to be proud that have come through in the last week. So you'll see the picture there, and again, those of you that I know, and there's people online at the moment that are active on social media, we've been sharing some of this. So in relation to our student mental health nurses, I've been gathering their own donations, and here's a picture of all of the donations they've put together to be able to share across our inpatient wards for service users, to keep them busy, to keep people occupied, when often the things that we normally do are quite restricted. So a huge thank you to our student mental health nurses. These are in year 2. And for me, I just think how fantastic, and I look forward to those student nurses becoming part of our workforce in the future. I think they're going to be great. It says a lot in terms of their values, and I certainly think they're going to be an asset to us. So we'll formalise our thank you back to them. And just while I'm talking about the students, you'll know as part of the national programme to bring more people to work in the health and care sector during COVID, year 3 student nurses were asked if they would come and work in NHS Trust. It was a national piece of work, and out of all the cohorts of nursing, the biggest uptake of that came from the year 3 mental health nursing students out of all of the pre-reg programmes. So a huge thank you to those. And what I've just found out this week is that within the last few months, the applications for student nurse training for mental health nursing has increased by over 20%, and for learning disability nursing pre-registration nurse training by 16%. And really importantly, some of the data that we've got coming through is a lot of that increase is in people coming through with lived experience, which is fantastic. And one of the conversations we have with Health Education England is further work to be done on widening access into NHS careers to make it easier and more accessible for people with lived experience, whether that's their own direct experience or experience of somebody in their family, caring for a loved one, family and friends. So I think that's fantastic, and the more that we can encourage that widening approach of Health Education England into careers, then we absolutely must continue to support that. You'll see there in the bottom hand corner, our LYPFT runners continue to set some fantastic challenges for themselves. So whilst I might have joined them by running outside, I'm nowhere near at a level enough to join them in on their Strava group. I shall watch for a little bit longer and let you know when I do pluck up the courage to join. But again, that's them encouraging one another in terms of their own health and well-being, so that's fantastic. I'm working my way around, so I'm just going to touch now on the blog that's been done by Hafsa, who's one of our staff nurses, and she really candidly shared her experiences in relation to being a mental health nurse, the impact of her faith in terms of the role that she does, working through Ramadan and how she was able to find that balance and get a balance that worked right for her. Really, really fascinating read. So if you've not read it, please do. And this is part of our overall approach, isn't it, in terms of how do we really have an inclusive culture in Leeds and York Partnership Trust. It's really about us taking the time to be curious, to listen and to hear from all of one another's experiences, whether it's people from a different culture, from a different ethnic group, whether that's valuing the experiences of our service users and our carers and the lived experience that they bring. That ability to be curious, hear the stories of others and share our own stories and our own vulnerabilities, I think is at the heart of taking a big step forward. And finally, I'll finish with, it is still Volunteers Week, and volunteers have always played a huge role in LYPFT. We've had a number of sessions from them over the years that I've been here at the board, and volunteers that have started, that have come in themselves with lived experience and saw that as a pathway through to paid employment. And we've certainly had a lot more volunteers join us through COVID to come and take support roles in the organisation. So a huge thank you. And again, you'll see through the various news releases that we're doing in social media is we're sharing some of those stories. So I've seen today we've sent out the story of Melanie, who is a volunteer within the gender service, sharing her experiences, and a volunteer to the Rainbow Alliance. So these came in just before the Zoom call. So one is about the distribution of the food grab bags at the Beckling in particular, and making sure that we've not got stock piling up somewhere that people can't access, and isn't it? So I've sent that through to Amanda Burgess and to Maureen to have a look at that, just to make sure that everyone at the Beckling knows how to access the food that's available for staff in those grab bags. The other email related to this, which I had this week, is from Tom Norman, who's in our physical health team at the Beckling, is recognising it's fantastic the amount of donations that we're getting for staff and for service users at the moment. But where we're getting those donations over and above what we reasonably use, we know that across our communities, there's a lot of people struggling. That a lot of people are struggling because of personal circumstances, financial circumstances, and those that were struggling beforehand have it even harder during the pandemic. So I've asked a couple of people to have a look at making sure everybody knows each of those sites where the donations are going to, that you can pass them on, send them on to the local food banks, local charitable organisations, places like Touchstone. I know we're doing some fantastic outreach, taking food supplies and donations out into people's own homes and communities in some of our most deprived areas of Leeds. So we should continue to do what we can to support. And I know that's something that we do every year. I know staff across the different sites do collections and donations to the food banks. Let's make sure that we continue to do that. So we'll send information out. Oliver and Tracy Needham are pulling that together in case you don't know where to send that through to. And then there's a very specific question about the access barrier being left up at the Beckling Centre. So I suspect that's up because of changes we may have made to the reception area, so it's not always manned. I'm not too sure, but certainly what we don't want is, as a consequence, people parking in the Beckling that don't work there, which means that our own staff aren't able to park. So again, I've asked Maureen Cushley, she'll have a look at that and see what changes we can make to sort it out so that staff are able to park when they're turning up for work. Right, I think that's all of my questions been able to answer. So thank you very much for joining me. The email address is there again. I'll just check if there's any questions that have come in. So a question from Judith about the additional guidance for community staff working in offices. Absolutely, we need to make sure that's part of our return to work, and certainly on the track and trace. That's one of the things we've asked for, and we're asking through the Directors of Public Health for specific guidance, because there's a number of the NHS and social care organisations trying to make sense of that. So as soon as we've got more information, Judith, we'll send that through and make sure our infection prevention and control team have got the right advice and guidance to be able to pass on. And a thank you there for comments about supporting Black Lives Matter. Absolutely, I think it's our moral obligation and our humanity of standing alongside those that are being so, I can't even put into words anyway, so I'll not try to. Right, I shall leave it there. So thank you very much everybody for joining me this week, and I shall hope to see many of you again next week. And in the meantime, please make the most of the changes in the restrictions that give you the balance with your health and well-being, but absolutely don't forget the fundamental ways in which you can keep yourself and your loved ones safe from COVID. Take care everybody, and I'll see you next week. Bye.